Gallbladder is a pear-shaped organ situated in the undersurface of liver. It is located on the right side of the abdomen under the rib cage. The main function of gallbladder is to store bile, which when we eat fatty meal pumps bile into the bile duct and through the bile duct into the small intestine, which helps in digestion. If your gallbladder is not functioning normally, then you might develop stone. The stones may be 1, 2 or sometimes 100. Sometimes gallstones are detected incidentally and they remain silent. Most commonly, gallstone causes pain in the upper abdomen, which radiates to the back or to the shoulder tip. The pain lasts for a few hours and subsides by taking medication. This is called biliary colic. The stone goes and stuck at the junction of the neck of the gallbladder and the cystic duct, and when it dislodges back into the gallbladder, the pain is relieved. But sometimes it does not dislodge and the pain continues for more than 24 hours. That is acute calculus cholecystitis, and if you are having persistent pain for more than 24 hours, it is advisable to attend a hospital emergency and seek urgent medical attention. If the stone slips and passes into the bile duct, it may obstruct the flow of bile from liver to the intestine and you may develop obstructive jaundice. And if it passes through the bile duct into the intestine, it may irritate the pancreas and cause pancreatitis. And if the stone has been there for many years, especially in context of Indian subcontinent, the chances you may develop gallbladder cancer.
The exact reason of gallstone development is not known, but there are certain predisposing factors that can contribute to gallstone development. So we have seen that it is more common in women, it is more common during pregnancy, women who are taking birth control pills or people who are on hormone replacement therapy, they are more prone to develop gallstones. Overweight or obesity increases the chance, and some blood disorders like sickle cell anemia can predispose to pigment stones. Sudden weight loss and some cholesterol lowering drugs can also predispose to gallstones.
It is easy to diagnose whether a person is having gallstone related problem by taking simple history, doing clinical examination, and ultrasound is enough to clinch the diagnosis of gallstone. If you're diagnosed to have gallstone, then few blood tests are necessary, mainly complete blood count to rule out infection, LFT, which might give any hint that the stone has slipped and gone into the bile duct. If there is any suspicion, then MRCP is necessary to rule out any stone in the bile duct, and amylase and lipase is done to rule out pancreatitis.
The treatment of gallstones is removal of gallbladder, and that is done by laparoscopic surgery. Sometimes people say by laser surgery or other names, but that is not correct term. Correct term is laparoscopic surgery or keyhole surgery. And in that, what we do is we make 4 small cuts in the abdomen, and we have special instruments and camera, and we go inside the abdomen and then take out the gallbladder. And while doing so, there is a small chance, say less than 1% chance of not able to doing the surgery laparoscopically and by converting it to an open procedure. Usually all symptomatic patients who are having pain or other symptoms, they require the surgery in an urgent basis. There are some people who are having silent gallstones, not causing any problems. In India, especially because of high incidence of gallbladder cancer, it is recommended that young patients with silent gallstone should also undergo gallbladder surgery. In an 80-year-old patient, if comes without any symptom and a silent gallstone, we usually do not offer surgery for that. Normally, gallstone surgery is very well tolerated, it doesn't cause any further restriction in your lifestyle. Common question is, if we remove the gallbladder, what will happen to my digestion and all? There is no change actually, because the gallbladder was already non-functional before the surgery. That's why the gallstone happened. In comparison to open surgery, there are many advantages of laparoscopic surgery. Like, you can go home very early, sometimes on the same day of surgery, or maybe next day. The pain is much less. You can ambulate very quickly, and you can go back to your normal life very early compared to open surgery. In open surgery, you usually keep the patient for 2-3 days or more, and the pain is more. So it is nowadays standard for patients of gallstones to have laparoscopic cholecystectomy.
Keyhole surgery for removal of the gallbladder or laparoscopic cholecystectomy is a very common operation performed in centers across the world with a very low rate of complications. Laparoscopic cholecystectomy is safe. Complications are rare, but complications are not impossible. Complications like infection, bleeding, wound complications like hernia, the complications of anesthesia and the drugs that are given for anesthesia are applicable to all operations, and so also for laparoscopic cholecystectomy. But the chances are low. There are certain complications or problems, however, that are specific to gallbladder surgery. Gallbladder surgery is performed in many centers, but centers like ours, which perform liver transplants and complicated operations on the liver, bile duct and pancreas, we often get referrals for patients who have had a cholecystectomy earlier but then develop complications, and then they are referred to us for treatment of these complications, specifically a rather sinister complication called bile duct injury. The gallbladder is stuck to the liver, and the gallbladder is also joined to the bile duct or the pipes of the liver by a thin pipe called the cystic duct. For most non-surgeons, non-doctors, it may seem surprising, but it is actually quite possible that during surgery, while the attempt is to remove the gallbladder only, it is possible that the bile duct may get injured. When the bile duct gets injured, it is not always because the surgeon has done a mistake. In the large majority of cases, it is because there is a problem, there is infection, inflammation, and everything is stuck, and identifying the structures becomes tricky. That's one possibility. And second possibility is that the anatomy inside your body, not everyone has the same anatomy inside the body. It is possible that you may have an anomalous anatomy which can play tricks on the minds of the surgeon, and it may appear as something different from what it is. Injuries of the bile duct had happened over the years, and even now it happens. When it does happen, you will typically manifest with fever or either fever or jaundice, yellowing of the eyes, or pain which is not decreasing but rather increasing every day after surgery. Sometimes the surgeon may even pick up this problem at the time of the first surgery itself. When such a patient is referred to us, we have to perform an open surgery and a bypass operation wherein we join the bile duct above the level of injury with some very fine sutures using magnifying lenses to see everything with more clarity, and this meticulous surgery joins the bile duct to the intestine by a hepaticojejunostomy. So bile duct injury is rare, it is possible, needs to be picked up in right time, but it can be cured. Another complication that may rarely show up or play up after gallbladder surgery is that, let's assume a situation where you've been diagnosed with gallstones, your liver function test, blood tests are normal, and the surgeon goes ahead and does a laparoscopic cholecystectomy. But later on after surgery, you may have some pain, or you may have fever, yellowing of the eyes, and some symptoms which are not explained in the normal process of recovery. you do an ultrasound or you do blood test, and then you may even need to do an MRI, and to your surprise we may find that there are stones in the bile duct. Now at surgery the gallbladder has been removed, but there may be stones which have been missed in your pre-op test. There was no suspicion of stones in the bile duct, but it is possible that your symptoms may be due to the bile duct stones. Not anything that is wrong with the gallbladder surgery. That part has been quite smooth. But if that is the case, so long as it's picked up, not a problem. Your surgeon would refer you to a gastroenterologist, and he would then do an endoscopic procedure through your mouth under some sedation called an ERCP, and they would generally be able to take out those stones and solve the problem of bile duct stones or CBD stones. A very interesting complication is cystic duct stump syndrome, which means you've had a surgery on the gallbladder, maybe years back, you've been doing very well, and then you have symptoms which remind you of the same symptoms you had when you had gallstones in the first place. You may have pain in the upper part of your tummy, the right side, you may have vomiting, and then when you do an ultrasound or an MRI, we find that there is a new gallbladder which has grown back. Well, actually it's not a new gallbladder. What is there is maybe a small part of the gallbladder has been left behind at first surgery, or maybe that little pipe I talked about, the cystic duct which joins the gallbladder to the bile duct, maybe in that part there is a stone formation, there is accumulation of fluid, and it swells up like a little new gallbladder, and this cystic duct stump which with stones inside causing problems needs to be operated, and we operate it typically laparoscopically or with keyhole surgery and take out the cystic duct stump. Very, very important to keep in mind, even after a very straightforward surgery, and probably you've gone back home the first day or the second day after surgery, your surgeon must have sent the gallbladder specimen for a biopsy. Please do collect the biopsy report from the lab or from the hospital. Have a look at it yourself. Go and show it to a surgeon, because unfortunately sometimes to your shock you may discover that the biopsy reports are cancer. Now, if unfortunately after a straightforward gallbladder surgery you have an unexpected biopsy report saying that you have cancer, immediately rush back to the surgeon, who will refer you to the right person, and in a proper hepatobiliary unit. Please get a surgery for this cancer. The surgery that you had earlier was a simple cholecystectomy, removal of the gallbladder. Now you need a radical cholecystectomy, a cancer surgery, in which beside the gallbladder you need to take out a part of the liver, the lymph nodes, and there is a very high chance that you may be cured of your cancer as well if this treatment is done at the right time. We talked about gallbladder surgery, the complications of gallbladder surgery, but keep in mind that there are complications of the gallstones itself. So if you have gallstones, your chances of developing complications of gallstones are higher compared to the chances of developing complications after laparoscopic cholecystectomy. It is because gallstones are more dangerous than gallstone surgery or gallbladder surgery that it is recommended that if you have gallstones, go ahead and get the surgery done. Overall, laparoscopic cholecystectomy is a safe form of treatment for gallstones.